Yeah, okay, so welcome everyone. We're delighted to see many people interested in this call, which I find fascinating, and I think we've all been waiting for a call like this for a long time. So my name is Adina Dumitru. I am a health and environmental psychologist at the University of A Coruña. I'm currently involved in the Connecting Nature project as a leader of Work Package 1, which deals with the impact assessment framework, so designing the measurements and the impact assessment indicators for nature-based solutions, especially focusing in our case on the health and social indicators. So the impacts that we can register in terms of social justice, social cohesion, and physical and mental health. I've also been working as a psychotherapist for many years, so I have this sort of double experience and insight in mental health from these two approaches. So that's why I find this call so exciting. I think about the time when I started actually working in this field, and if you talked about nature-based prescriptions, this would have been seen as a new age topic that nobody would have taken serious. We've gone a long way. And I'm delighted to see that we now have this call, and will be very interesting to hear from all of you what you think the opportunities are, the interest you have in this call, whether you work on nature-based therapies, either from the research or the practitioner perspective, and so that we can dive into this call a little bit more. So let me just start then with a short presentation, just looking at the details of the call. Okay, great. So I'll do a short introduction because I'm aware we are over time. And then we would like to go into a few pitches to hear about your interest in this call. And we have here Sophia from BAX who will get us started with that. We'll also go into a short poll to hear from you. And then we'd like to do a bit of brainstorming around your interests and ideas for this call. So this is, as Tiago already mentioned, this is a Destination 6 topic, and it's a research and innovation action. It's a two-stage call in this case. So the first deadline is 15th of February of 2022. And the final, if you go through the first stage, as you all know from our experience in Horizon 2020, then we would go at the second stage, and the deadline for that is the 6th of September. It has a budget of 6 million. So as we've seen the sort of a list of calls, we see this is quite a generous call compared to the other ones. So there will be free funded projects most likely. And the expected outcomes for this call have to do with those general priorities, as Emma was mentioning a few minutes ago. So on the one hand, establishing the EU as a leader in the digital, economic, and ecological transitions, and supporting the European Green Deal priorities, especially the biodiversity strategy for 2030. And we've seen that actually there are two sort of main expected outcomes for this call. One is the development of nature-based therapies to help communities turn the ecological transition into opportunities for good health and well-being and increased resilience. And we've heard here that two of the main things are establishing causal relationships between green spaces and health and well-being, and on the other hand, making sure that we develop nature-based prescriptions. And the second is obviously showcasing the potential for the creation of green jobs, as in all the Horizon Europe, nature-based solutions goals. In terms of the specific topic expected outcomes, what the call expects us to do is get a sharper view of green space management, nature protection, agriculture, and forestry sectors. So establishing these cooperations in order to provide nature-based therapies. So here we see that that co-creation that also Emma was alluding to is very important, and establishing those linkages of collaboration and co-creation and governance between the healthcare, social, and educational sectors, establishing a stronger evidence base. I think this is probably one of the most important expected outcomes for this call, for the causal relationships between nature and health and well-being, and for more effective nature-based prescriptions. Cost-effective nature therapy prescriptions are going to be more widely used in the healthcare sector, so we also have to advance in the implementation of these prescriptions, and probably the organization of more effective pilots in different places. And we will have to evaluate what the cost effectiveness of these prescriptions are or is. The fourth expected outcome has to do with awareness, both of policymakers and citizens, of the positive benefits of nature for health and well-being. And here we enter into the effective dissemination and communication strategy that we put in place, and sort of the educational and citizen engagement strategy. And finally, we ensure that healthcare professionals, but also citizens, use on a wider scale nature as a form of preventive medicine. Although you will see, if you read the call, that mental health and circulatory cardiovascular diseases are mentioned, it's pretty clear that we can also expand the scope to other categories of illness, which I think are important and are amenable to nature-based prescriptions. In the scope, the call already gives a few hints on what the main pathways we should consider, or that are considered important based on existing evidence. On the one hand, that urban environments can have a negative impact on physical and mental health. The call also mentions particular urban stressors such as noise, crime, and pollution. And mentions again what I just said before, which is that mental illness and especially cardiovascular and circulatory diseases are considered particularly important, as they are some of the main contributors to the global burden of disease, as we've all seen in the World Health Organization reports recently. So one of the, again, interests of this call is to determine also the degree, and we know there's a lot of debate in the scientific evidence and literature on this, the degree to which nature might actually lessen or address this burden, especially as opportunities and time spent in nature decrease, as we know, especially in urban environments, which are also very, very specifically, as you've seen, mentioned in the call. So here we enter into things like the type of exposure, the dose of nature that's necessary. And we know there's a big debate on that, and also the different effects nature might have on different social and age groups. Again, very specific concepts are we should address in future proposal. First of all, as I said, causal understanding is emphasized because we know there are a lot of correlations there, and what the call is now looking for is a clearer causal understanding of the relationship, which we know needs particular methodologies such as experiments or randomized control trials, for example. We emphasize the importance of long-term effects of the relationship, which are actually less studied and recognized in policies. Especially, for example, we know there's available research on childhood experiences and the extent of childhood experiences and how it affects mental health in adulthood, for example. The call also wants to get a grasp on the social, economic, and cultural factors that influence both how we experience nature and also the effects and outcomes that we derive from exposure to nature, and also maybe the differential exposure that different social groups, socioeconomic groups have to nature, and different opportunities for accessing nature therapies. And factors such as age, gender, and socioeconomic status are again considered very important, and we should address them. We should address type of interaction and form of sensory input as examples of what conditions, benefits derived from nature-based prescriptions in terms of mental health. And finally, we should address the different cultural perspectives and experiences that might influence how we experience this relationship between nature and health and well-being and the kinds of benefits that we derive from it. So we can see the call is actually pretty clear on what it looks out for, and it's open, as all European calls are, so that we can address different types of illnesses, but also different types of forms of therapy or nature-based prescriptions that can be derived from the experiments carried out within such a project. So I'd like now to ask Isabel to bring out the poll. We would like to hear from you. So where are you from, just briefly? And whether you are coming from research or from the practice side of nature-based therapy. And also what is maybe the particular angle you've been working from or the sort of you would like to approach this call from. Also, I forgot to say, and apologize, that you can ask questions at any point in the chat, and we'll keep an eye on that so that we can see whether we can answer some of them. And also that, as with all the sessions of this summit, we are recording this session, and the session will be available later on for all of you to access.
Thanks, Adina. Just so everybody can see, on the right-hand side, there's a poll section. Now, it's not as user-friendly as as I would have liked for it to be. So in terms of questions, I could only ask, were you from Europe or outside Europe? And we've asked whether you are researchers, practitioners, or city or policymakers. And unfortunately, because you can't, there's no free text facility. So maybe in terms of the third question we wanted to ask you, maybe pop it up into the chat. What's your area of interest in this call? It would be great. Yes, Gillian, I know you can't tick both, but anyway, it's just really for us to get an idea. So I think we have at the moment we have 17 votes for Europe and two people from outside Europe, which is great to see. We have mostly practitioners here this morning, 11 votes. Oh no, actually even polling researchers and practitioners, 11 votes each, and city and policymakers. So you can still, we'll have another look maybe at the end of the session to see have those numbers gone up, and then maybe if people want to put into the chat what their angle of interest is, we can capture that information that way.
Yes, thank you very much, Isabel.
Okay.
So yeah, just feel free to drop us a few lines in the chat. I think it'll be interesting for all of us to see what your specific interest in this call and generally nature-based therapy is in further exploring, you know, the effectiveness and the efficacy of nature-based therapies for health and well-being. Shall we then, while people are doing this, bring up the pitches? So what we'd like to do now with you is for about 2 minutes, just come on stage and tell us live about your interest in this call, how you'd like to approach it, and whether you've previously worked on this and from what angle, again, as we were saying. And I think we're going to start with Sofia Aivaliotti. Is that so, Isabel? Hi, Sophia, if you could introduce yourself first, and then the floor is yours. Just let us know about you and your interest in this call.
Hello, Adina. Hello, everybody. Good morning. Thank you for inviting me to have on the stage of inside my kitchen, actually. So thank you very much. I'm Sofia Ivaliotti. I work for Bax & Company as an innovation consultant based in Barcelona. Bax & Company is a small company, for 40 people around Barcelona, Utrecht, and Cambridge. We're quite internationals, and we work a lot with various innovation, sustainability projects, with technology, with nature, and specifically my group works with climate and environment. And so we're very pleased to see this call coming up. Like, it was not only scientific or a practitioner interest, it's just like very exciting to see this transition in Europe. And it was a topic that we had envisioned like a few years ago with another proposal. So we've been already thinking about it. And then in the meantime, we have been working with a network of cities that's called Healthy Cities, and it's more about like urban planning and health and how these two interact and how the communities can access these green spaces and how the green spaces should be designed. On this part, well, personally, I'm involved in the health impact assessment aspects, and I'm interested also to see like this interaction. And within this topic of the nature-based therapy, well, I cannot say that we have like the topic yet. It's to be defined, but our vision is to bring nature into the city. So like explore this potential and then bring people into nature in different ways, like bring their nature in the doorstep and then bring them, like make them access and see the nature. And this, well, of course, requires a lot of like scientists, which we're not exactly that. And it requires like a lot of evidence and see what works in both ways for good health in nature and good health for people. And we are open for different approaches, as you said, like different types of illnesses or different types of therapies, like a lot of things that we can experiment. So for us, it's like it will depend a bit on a different coordinator. We can say that we are very good in developing concepts, and we can help like a team to write a proposal, but not necessarily we would be the perfect match for like coordinating this call. Maybe like a bigger, more scientific or more like mental health related organization could be more appropriate, I would say, but we can definitely be the energy behind it. And yeah, we're very interested to coordinate and collaborate with people who are hearing us today, and to hear from you and your opinions. And also a bit on our role, we are doing, we can take part in the policy advice and awareness, on mainstreaming, creating business cases, and also like looking into the public-private partnerships in order to accelerate this kind of like therapies, prescriptions, and this new way of like preventive medicine, and looking into these aspects as well. And also we're working on a tool on the Healthy City Generator, which looks more a little bit on the space as well, on urban planning and health, and how the city should be planned and designed in order to make a decision. So a bit on this side and less on the medical. Also, we have a lot of experience with nature-based solutions.
Sorry, Sophia, can I stop you there? It's been almost 3 minutes, so we have a few more pitches. Thank you very much for your little pitch, and we will have some time later to write down your main points as well on the Miro board. Adina, I believe we have 2 more pitches. So I'd like to give the stage now to Deirdre McIntyre. Sorry if I mispronounced your name.
No,
could you you see on the top right of the screen, you see ask to share audio and video. If you can click on that, then we can add you on stage. And Shirley Gleason, can I ask you to do the same? Yeah, okay, let's go ahead with Shirley first then.
Okay. Hello, everybody. I'm Shirley Gleason from Eco Wellness Consulting and Adore Centre for Integrated Forest Therapy. We've been training nature-based practitioners for the last number of years to deliver complex interventions around the area of positive mental health and well-being. Our backgrounds, we work with various practitioners, background in health promotion, social work, psychotherapy, psychology, forestry, the environmental sector. And our main interest is developing competency and best practice and capacity building amongst practitioners to deliver green prescriptions and nature-based interventions. We're very interested in the whole area of environmental ethics and social justice, and we think that needs to be incorporated into any work or design that needs to happen. Also, what we're interested in is the area of developing appropriate green spaces, therapeutic spaces, because we know at the moment a lot of the urban spaces are not appropriate for some of the groups that we work with, maybe with chronic mental health difficulties, stress and burnout. So we're very interested in this area, also looking at the referral pathways. So how do we actually integrate the work into the health and social care systems? And I think there needs to be a lot of education and work done in relation to that. And also look at the area of behavior change and motivation. You know, just because we develop interventions doesn't mean that people will attend. So also to look at the barriers around that and inclusion. So we hope to be part of this whole conversation, whatever way we can. We've trained practitioners from over 35 countries. We've trained government organisations in forest bathing guides, integrated forest therapy practitioners, also trained health professionals in complex intervention design for nature-based solutions. So delighted to be here.
Thank you, Shirley. I haven't been able to contact Deirdre and haven't seen anything in the chat from her either. So I guess, shall we just move on to oh, there she is. Okay, yeah, great.
Oh, can you hear me?
Perfect.
Oh, stop. Hi, Esme, can you hear me?
Yes, your connection is not great, but...
Oh, I'm so sorry. I think my, yeah, the internet is too reliable, so please bear with me. I'll keep it as succinct as possible. I'm a clinical psychologist by background and spent over 20 years working with the health services, particularly in community psychology services and child mental health. And but then I left as a independent training and research institute. We specialize in psychology, online education, training, educators and other professionals. We've been doing this for over 20 years across Europe, in Ireland, in the UK and in Australia. So we've developed, I suppose, an expert in online and training interventions for well-being. Our specific focus is kind of inclusion, and I suppose kind of one of the things that we're involved in is applied research in the mental health, resilience and nature connection. And we've developed a range of evidence-based programs and interventions across the years for children, and a recent one is a specific for reducing anxiety in third level using a sort of gaming application. Involved working with traumatized youth to develop trauma-sensitive learning environments for educators, and so many of these involve connection and nature-based solutions as part of them. Working on a number of European and national projects on health and wellbeing, including Go Green Roots, which is an Irish-led Horizon 2020 project funded under the Research and Innovation Fund. And this project focuses on promoting urban health and wellbeing and on the effects of nature-based solutions and technology across 6 cities across Europe and indeed beyond. And our role in Go Green Roots is essentially to coordinate a work package which involves supporting nature-based solutions through providing a series of online learning tools. Now, these are digital tools which are going to be co-created and designed to foster a number of dimensions, including psychological resilience, sustainability, nature connectedness, and also to promote engaged citizen science activities. And we suppose I see this call as building on the expertise and experience developed project, particular interests include mental health and well-being, co-creation, as or bringing a developmental perspective and lifespan perspective to therapy interventions, you know, tailoring them to the specific needs of different groups. We're in co-creation and participative methodologies, people at the center, empowering and giving voice to those at the margins. We're also interested in community groups in cities in the north of Ireland. We're interested in the potential of nature-based solutions and nature connection to mitigate the effects of intergenerational trauma, particularly in post societies and traumatized and deprived communities. We feel it has potential, incredible potential to reduce health and other inequalities. I suppose about the whole area, we've been working in it kind of by accident, found ourselves developing this expertise.
Sorry, Deirdre. Yeah, no, I'm just keeping an eye on the time, and I think you already provided us with quite some detail. Thank you.
Thank you very much.
Thank you. Adina, I think we'll move on to the Miro board now.
Yes, just a second first, Esme. We have just one more slide that I'd like to share.
Oh, yes, of course.
Just a second. Let me see, why don't I? Okay, I'm getting it now.
That there's lots of, there's been lots of input in the chat there from different people. So we will collect all the details and produce a mailing list or whatever afterwards, so people can interact and come with each other.
Yeah. So just one more slide to kind of frame the call again. This is a slide that tells us about what proposals should be doing. And as you've heard already from the pitches, we see some very exciting things coming up, both from organizations that work in training, work in specific interventions delivered to particular social groups, and also the kinds of approaches to different types of mental health problems, such as anxiety, such as depression, and trauma also, which is, I think, a really interesting field for nature-based therapies and prescriptions. So we see that the call asks us, again, as with most nature-based solutions calls, I must say, to develop a common framework where we can help European countries and regions to recognize and promote contact with nature, and also use this contact with nature as a cost-effective response for the prevention and treatment of human health and well-being. The projects should also propose an interdisciplinary and cross-sectoral approach. So again, working with different actors, with different stakeholders involved in both the green space side of things, and especially urban green space and green space management, but also the healthcare sector and citizen groups, citizens associations, to improve schemes for monitoring and evaluating the nature and health linkages, and again, provide more evidence. I think there's still insufficient integrated evidence on a larger scale about the kinds of, about the effects of nature-based therapies on different social groups and for different types of issues. To develop here, we get an understanding also of the types of methods that this call is looking for. So both longitudinal prospective methods, which would help us to get a better view of the causality that seems to be an important part of this call, quasi-experiments or well-controlled intervention. So again, we're talking about methods that address the causality issue. The call or the projects that answer to this call should also test different nature therapy sessions. And on the basis of that, the results they obtain, identify best practices and develop tools and guidelines for integration of nature-based care within the public health sector. And finally, what the proposal should do is also identify the arrangements, legal and administrative, that would allow for effective prescriptions, for referral systems, and for the establishment of partnerships that can also make for these cost-effective mechanisms for the implementation of these sessions. So here we, the call alludes to things like insurance and civil society organizations, third sector organizations that might be part of this referral system, and how can that be articulated on a legal, administrative, and financial level. So with that, I will stop sharing just to frame our discussion now in Miro. So please go ahead, Esme.
So I just posted a link in the if you can join our Miro board. I won't share my screen because it might be a bit difficult looking at the screen and the Miro board at the same time. What you find on the Miro board is we have two things we would like you to fill out. We first have a question about what are the gaps and opportunities or ideas you would have on this call. So you can just grab one of the post-its there and write down any idea or gap or opportunity. We'll give you a few minutes for that, and then we'll briefly discuss that. And then after that, we will move on to the expected outcomes. And it would be great if you could all grab a post-it there and write down why you are interested in this call and how you can contribute, your organization details, your possible role in the project, and your email address, actually. So we can contact you, and people who are in the session can contact you after. And then you can just put one of your post-its on one of the expected outcomes that you find most suited for this one. So yeah, I guess we'll just first go to the gaps, opportunities, and ideas you have for this call. And if there's anybody who cannot get into Miro, just drop things in the chat and then I can add it for you. I already see quite some people in here, so I presume it's going well. Yeah, so Amanda, do you see, maybe I'll do share my screen for a minute. Do you see my screen now? Could you share your screen, Adina? I don't think I have the rights to do it.
Yes, I think I can. Okay, let me see. Yes.
See, Deirdre, there's a link there in the chat to Miro. On that, it'll bring you into the Miro board.
Can you see it now?
It's coming up now, Adina, yeah.
Could you scroll? Could you go scroll up? I think it's. I'll scroll around the board a bit. I don't know where you ended up. It's always a question with these kind of.
Yeah, this is. Are you talking to me, Esme?
Yes.
I don't seem to be able to scroll around a lot.
Let's see if I can share my screen.
Yes, that's a good idea, actually. Try to zoom out.
Oh, yeah. I think this is much better.
Yeah, and then scroll to the left, because that's... Sorry, I could not delete that anymore for some reason. Yes, that's where we need to be. Perfect, thank you. So yeah, so you see that already quite a lot of people are adding their ideas.
We're right here now. On gaps, opportunities. There are already really interesting questions being formulated here. such as who has the data and can we get it spatially? How can we capture the economic value of the health benefits and link them to open space development and stewardship? How can we address vulnerable groups? Developing the co-sharing of land. Don't forget the UK and the bit, that's a good one. I actually think the UK in this case is a really interesting partner. You developed really interesting pilots on nature-based therapies.
Mm-hmm.
And it's also interesting to know from other countries maybe represented here, whether there are any, whether you have any knowledge of pilots going on within the healthcare system, trying out nature-based referrals or nature-based prescriptions, or just nature-based therapies. And also we have here a few people from outside of Europe, maybe Latin America. Mariana, I think, was saying she works in Europe, but she's from Latin America.
Do you want to summarize the first gaps and opportunities, and then we can go to the expected outcomes?
Yes,
and people can have their contact details there.
Yeah, so I think we've been saying it as we went along, but you can see that it's actually we have here very well represented the different dimensions of the call. So on the one hand, co-creation and co-sharing opportunities and schemes for nature-based therapies. And also, while we, this goes to the administrative and legal arrangements as well, side of the call. Some ideas about, some gaps pointed out related to both data and also practice, the idea of having to mainstream the practice. And so we need more evidence for that mainstreaming of the practice. Different social groups being affected, we need to know more about that, especially vulnerable groups, young people, and getting a scope of different types of cities, for example, very overpopulated cities in Europe and outside of Europe, different European and non-European pilots that have been carried out and can come in as partners. And also this idea that we need to have spatially represented data in order to use it for decision making, and use OPLA as a platform and as a common European platform to share best practice and mainstream ideas and pilots. So yeah, please continue, Esme.
Okay, thank you. Yeah, so if you scroll down a bit now, you can see the 5 expected outcomes of this call that Adina presented before. And if you can grab one of the post-its on the side and just add there why you're interested in this call or how you can contribute, your organization, possible role and your email address, and then drag it into one of those 5 boxes. Then that would be great. So people can contact you after. And of course, if you are not on Miro, please feel free to put it in the chat, because we will capture the comments from the chat as well. Thank you, Amanda. I will add that to the board. Anybody else that cannot get to the Miro and want me to put something in for your organization, let me know. Then I think, because we already have quite some posted actually, Adina, so I think almost ready to finish up.
Yes, thank you, Esme. So we can see here that there are several proposals here to organize case studies and pilots. I think this will be one of the key pillars of this call, that we can look at different forms of therapy and different pilots for different social groups in a variety of European contexts and also non-European contexts. As we've seen, the call encourages strong collaboration between Japan, the US, and Latin America. And should I also say here that I know one of the things I've also been acting as an expert reviewer for the European Commission for the Horizon 2020 calls. And one of the things we've seen in many calls is the fact that that a lot of people tend to go to sort of the most classic types of interventions. For example, you can, I'm sure for this call, a lot of people will do a lot on forest immersions, which is good. We need a lot more evidence on forest immersions, definitely, but it would be nice to see a wide array, I think, of approaches for this particular call. And sort of, there's also scope and place for bravery, I think, in this sense, in taking on different approaches, different forms of therapy. In terms of stronger evidence, again, Gillian, I knew that was you. Data, we need data to be spatially distributed so that we can make decisions, to be spatially represented, so that we can map cities in that way and also green spaces in that way. There's a series of forest therapy works that people are doing for cancer, for example. I think that's an interesting also category of illness that is also a priority, as you know, for the European calls at this point. There's a whole mission on cancer that the European Commission has started. So there's interesting synergies with that as well. In terms of cost-effective nature therapy prescriptions, of course, the projects would need to support innovation and mainstreaming. So creating communities of practice, but also train, especially, I would say, healthcare workers and other organizations that will deliver the nature therapies. Schools are an important agent in this, I think, in terms of a very relevant actor in ensuring especially childhood exposure to nature, and making sure that and establishing that relationship between childhood experiences and maybe the effects on mitigating stress from childhood adverse experiences, for example, and later adult mental health, intergenerational trauma, someone mentioned before as well, that could be considered here. Capacity building is, of course, an important issue here, that we develop competencies, referral systems, best practice guidelines, ethics, both clinical and environmental, and also that we would have professional development programs for these kinds of interventions. If we go to the greater citizen policy awareness, we need to also empower communities, both to deliver and also involve different social groups, especially vulnerable social groups, in these programs. There's different projects that are being started in different places on this. And finally, in terms of the wider utilization, we have here again training and mainstreaming of capacities, but also I think referral systems that were mentioned before can constitute an important part of this. Yeah, so very interesting ideas. As I was saying before, I think this is a really, really exciting call, and I think a lot of us see it like that. If you continue to write here and in the chat, please provide us also with your contact details. I think that's really important. And also with the most innovative things you're developing right now in terms of therapies, in terms of pilots, in terms of capacity building and training, because I think it's very likely that a few of you present here will be part of these calls and of the proposals going out for these calls. From us, from Connecting Nature, already Emma mentioned partners that are interesting. I just wanted to mention that here also at the University of A Coruña, we work on nature-based therapies, but also on AI tools. So we look at artificial intelligence tools for both management of data, but also for different types of delivery of nature-based prescriptions and nature-based therapy, especially for people who cannot have access to nature in a direct way. So, you know, simulations and mediations through digital tools can also be used in these cases. Yes, so I think we can wrap up here. Esme, thank you very much, everyone, for taking part in this very interesting session. Very lovely ideas that you've been putting forth here. And we look forward to establishing further collaborations for this and other calls, because I think this topic and mental health in general is going to be a big aspect of the Horizon Europe agenda moving forward, not only in this work program, but in the other, in the future work programs. And thank you so much, Isabel and Esme, for your support and participation in this session.